Well, cystic fibrosis is an inherited chronic disease that affects multiple parts of the body, most commonly the lungs and digestive system. Although no cure exists, there are methods to prevent the disease. And joining us now in studio is Dr. Susan Klaugman. She's head of pediatric pulmonology at the Cystic Fibrosis Clinic at the Charlotte Maxeke Hospital, and NiQi, who is living with the disease. We also want to know that today is Cystic Fibrosis Genes Day, which starts today. The play on the word genes, as in Genes, as opposed to Jeans. Is that right? Yep. All right. Anyway, I'll start with you, Dr. Klaugman. Just explain to us what exactly cystic fibrosis is and what kind of effects it has on your body.
Cystic fibrosis is a multi-system disorder. In other words, it affects all the organs in the body, but primarily the respiratory system, in other words, the chest and upper airway, and the digestive system. The symptoms that patients present with, generally, one is alerted to the fact that you might have a patient with cystic fibrosis if you have a person who is coughing a lot or is wheezing a lot, and a child who has recurrent respiratory tract infections and pneumonias. In terms of the digestive tract, most of them can't absorb their food, so they present with failure to thrive. In other words, do not gain weight very easily as children.
And is that when you pick it up, obviously when they're young children?
It's difficult to answer that. Many people are only picked up in their adult years, depending on the severity of the disease. There are over 1,800 different mutations, which means that there are many, many ways in which the disease can present. From the most severe, which will present probably in the newborn period, to adulthood, and even to men who are experiencing infertility. They may only be diagnosed as adult men, but they then obviously have less severe disease.
How common is it?
Again, a difficult question to answer. In the different racial groups of South Africa, it has a different predominance. In Caucasians, 1 in 20 people carry the abnormal gene. In other words, about 1 in 2,000 people will be affected with the disease. We used to believe it was only a Caucasian disease, but in the last 10 years or so, I think we've come to realize that all racial groups in the country are affected with it. And clearly, a lot of our patients have been slipping through the ropes because we didn't realize that blacks and people of mixed ancestry also have the disease. So in the black patients, we really should be seeing about 130 new babies every year. We're seeing nothing close to that. So obviously our diagnostic abilities need to improve, and our index of suspicion in terms of other races being affected needs to improve. We don't really have an incidence for our Indians, and in our people of mixed origin, probably 1 in 12,000 people are affected.
I wanted to speak to you about, obviously, the diagnosis, because, I mean, you see someone coughing, you think, oh, they might suffer from a chest infection. What makes cystic fibrosis different?
Often the nature of the cough is different. An asthmatic would have a dry cough, whereas a person with cystic fibrosis tends to have a moist cough. And I think it's the event of recurrent coughs that makes one suspicious in the presence of a person who might be thin and wasted, or a baby who's not gaining weight. In fact, people with cystic fibrosis tend to sweat a lot. And many parents will tell us, retrospectively, unfortunately often, that when they kissed their babies, they tasted salty, or that their children used to sweat a lot and salt crystals would appear on their skin, but nobody ever took notice of what they were saying.
All right, NiQi, I'm going to come to you. Obviously, you're a cystic fibrosis sufferer, or just explain to us at what stage you realized or came about that you might be suffering from cystic fibrosis.
Well, I don't think I actually realized that I came about it. I was actually diagnosed at a very early age. I was diagnosed at 6 months old. I was born to a 17-year-old unmarried mother. It was quite a bad situation, and welfare stepped in. And at that time, what the doctor was talking about, I had those symptoms. I was salty. I didn't gain weight. I was coughing and everything. So unfortunately, they didn't diagnosed me in Vryheid because that's where I was born. So they moved me through to Pietermaritzburg Hospital, Grace Hospital. And at that time I was diagnosed with cystic fibrosis. There was a family there whose son was in for treatment. And their GP approached them and said, there's a little girl here that has cystic fibrosis and she needs to be fostered. Wouldn't you guys, consider fostering her? So, I was taken home with them and I've been with them ever since.
Wow.
So they are my family. Their son that was ill, unfortunately, he did pass away when he was 9. So it's been quite a rough road.
With cystic fibrosis symptoms?
Yes, definitely. He was a lot worse off than myself. His stage of progression was very, very bad, and it had happened very early. Whereas me now, my stage of progression has only happened at the age of 23, So from about the age of 17 or so, when I finished school, my disease progressed to a worse stage. More hospitalizations. I have to go in every 3 months for 2 to 3 weeks for routine IVs to, clear up infections and to have a good dose of physio to get out, all the secretions. And also to pick up weight, because weight is a big issue. And when I'm in hospital, all you do is eat. They just pump you with food and they give you lots and lots of supplements to try and pick up your weight,
On a daily basis, what kind of medication? Do you take medication on a daily basis?
I pretty much have a pharmacy in my house.
Really?
I take 20 odd medications a day.
Tablets?
Yes, tablets, yes, And then along with the tablets, I have to do inhalations, which is in a nebulizer, which, I have to breathe in and then it helps clear the lungs. And along with that, I have to do physio. So I have to do, chest physio to try and help move those secretions and get them out of the airways so that I can breathe and there's a less chance of infection occurring.
And obviously it's affected your life in a huge way. Things like sport becomes difficult with chest problems. How has it affected your life?
It's been difficult. In my younger years, it was a lot easier because I wasn't as sick as I am now. Sports and everything, it was easy, and you have to do it because the more active you are, the healthier you are. So in my younger years at school, I did every sport under the sun. I was on the cricket team with the boys. And then I moved up to Pretoria and I did homeschooling. And that lack of sport is where my disease progressed because I wasn't active. So it's been difficult, especially with, the social aspect, because with homeschooling, you don't really, come across friends that easily. And also trying to explain to people that you have this disease it's difficult because people don't understand and there is no knowledge about it. So I could just be, standing amongst a group of people and I have a coughing fit. And then, they look at you like you're dying and you say, oh, you're okay. And I'm like, no, I'm fine. And then, trying to explain it it's quite difficult.
I'll come back to you, NiQi. Obviously, Dr. Klaugman, it's a genetic thing. I mean, is that the main reason behind it?
That is the reason behind it. Each of the parents of the child carries an abnormal gene which would code for cystic fibrosis. Now, depending on the actual gene mutation, that will affect the severity of the disease. So if you've got 2 very severe mutations coming together, then the child will be affected in a severe fashion. If you've got 2 milder mutations, they're the ones who might only be diagnosed either in adulthood or late adolescence.
Now, NiQi, for the youngsters out there who are suffering from this, what do you say to them in terms of a positive attitude? I'm sure that plays a huge role in this. Exercise is another one. What would you say to them?
Well, the only thing that you can say is to be positive. There's nothing that you can do about the disease. Unfortunately, you are born with it, and you have to deal with it from a day-to-day basis. And if you let it get to you, then that's when things are going to get worse. That's when you're going to get depressed. And when you get depressed, your disease gets worse because your emotions actually tie a lot into how you feel physically. So the only thing that I can say to the other CF sufferers out there is you have to be positive. And myself, I know that I'm a role model for younger CFs. So I have to be that shining star for them, someone that they look up to, somebody that does their physio, that does their medication, the person that goes through the lung transplant process and is a shining star for them, as a role model.
Dr. Klaugman, she brings up an important issue, like a lung transplant. Is that a possible, in terms of treatment, how do you treat it?
A lung transplant or the
sorry,
disease?
the CF.
In exactly the way...
Is a lung transplant an option?
Well, a lung transplant is kind of end of the road action. We don't send people for lung transplants unless their lung function has deteriorated to such a point that they're unable to function on those particular lung functions. But as NiQi says, our treatment is very aggressive in treatment, not in our natures. They need to take digestive enzymes with almost everything they eat. They need to do physiotherapy at least twice a day to mobilize these secretions, and that is particularly time-consuming. The physiotherapy is usually preceded by a nebulization with a medication that would open the airways up to facilitate drainage of these secretions, and often they need to nebulize after physiotherapy again with an antibiotic or other substances which will work on the mucus to either make it thinner, more liquid, and easier to expectorate. So it is a very time-consuming disease.
And expensive, no doubt.
And very expensive. And that's well, some people are fortunate enough to have medical aids which will assist them, but many people have to attend provincial clinics because they could not afford it on their own.
Are provincial clinics assisting?
There are clinics in almost all the provinces.
That deal obviously with all the medication for cystic fibrosis.
We do need to fight a lot for what we need, but I think with the fighting spirit we get most of what we need. And definitely, I mean, in the time that I've been dealing with cystic fibrosis, the prognosis has improved tremendously over the years, and that can only be because of earlier diagnosis, better care, and availability of good medication, and not to minimize physiotherapy. Physiotherapy is the mainstay of our treatment. Without adequate physiotherapy, the lungs are going to deteriorate.
Now, you've also got a campaign, you've got a little sticker on your jersey there. What is that, the campaign that you guys are running?
At the moment, we're trying to promote cystic fibrosis awareness in the population and in our medical fraternity. Unfortunately, not many doctors are fully aware of all the symptoms and all the presentations. And we're trying to promote awareness both in the medical fraternity and in the general public. Clearly and obviously, if the earlier the diagnosis is made, hopefully the better the prognosis would be, because we wouldn't allow the patient's lungs to deteriorate by wasting time and wasting years treating for other conditions. And we would like to promote it amongst the general population so that they're aware of who to refer to our clinics or who to investigate for the possibility of cystic fibrosis.
Well, listen, unfortunately, we're out of time. I appreciate your update. Thanks very much, NiQi. Best of luck. Keep going. Wish you all the best in health and happy days and many happy days ahead of you. I'm chatting to Dr. Susan Klaugman. She's the head of Cystic Fibrosis Clinic at the Charlotte Macleche Johannesburg Hospital. NiQi During. She's a cystic fibrosis patient. Thank you so much for joining us both.
Thank you.
Thank you.